What's up, beautiful people? Another day, another study. We've talked a lot about obesity on the channel. We've talked a lot about dementia on the channel. Here's a study looking at both and looking at a potential causal link between obesity and a certain type of dementia called vascular dementia. It's called vascular dementia because we think that the preceding factor is impaired blood vessel health. One of the number one risk factors for it is hypertension. So what happens is you get small infarcts and hemorrhages in the brain due to the disorders of the blood vessels. And this leads to injury to the brain, inflammation in the brain, and then a dementia phenotype. So obesity is a metabolic disease associated with increased risk of diabetes, cardiovascular disease, certain cancers, premature death. Observational studies have shown an increased risk of vascular dementia in obese individuals. And then we also see that treating obesity-associated conditions like hypertension, hyperlipidemia, hyperglycemia have been shown to lower the risk of dementia. And this study was done to further assess the causal relationship. So does obesity cause vascular dementia, using a technique called Mendelian randomization and using data from 3 different population-based studies. So in the one sample MR analysis, so the difference between one sample and 2 samples, one sample, basically all of the data is contained in a single data set, whereas in 2 sample, you may use different data sets to assess the risk. In a one sample, the MR analysis, a 1 standard deviation higher BMI was associated with a 63% increased risk of vascular-related dementia. In the 2 sample analysis, depending on the statistical method that you use, the risk was an increase of 54 to 98%. And then the 1 sample MR analysis showed a 156% increased risk of vascular-related dementia per 1 standard deviation higher systolic blood pressure. A 2 sample MR analysis using the inverse weighted method had a 4% increased risk in vascular dementia per 1 standard deviation higher systolic blood pressure. And diastolic blood pressure had higher estimates in both the 1 sample and 2 sample, 232% and 11% MR analysis. And in the mediation analysis, when they looked at blood pressure, systolic blood pressure accounted for 18% and diastolic blood pressure for 25% of the association between higher BMI and vascular-related dementia. So this is something that I look at very closely in my clinic. I have people monitor their blood pressure, and I'm pretty aggressive in lowering blood pressure because of the risk of vascular-related dementia. This is something that I take very seriously. We've talked a lot about dementia. I'm an ApoE4 carrier, so I have a higher genetic risk of dementia. So making sure that my blood pressure is good, making sure that my body mass is good. And I know BMI has some limitations, but the correlation between high BMI and being clinically obese is pretty high. It's like 0.7 something. So if your BMI is high, it's probably not because you're jacked for most people. Now, of course, there are individual variations there. Like my BMI is high, but my body fat percentage usually stays around 15, 16% or so if I'm not trying to lower it intentionally just to feel more shredded or for whatever reason. Either way, making sure we're at a healthy lean mass, a healthy body fat percentage, making sure our blood pressure is well taken care of is important for reducing our risk of developing vascular-related dementias.